to us, but they do have issues with waiting lists and things like that. Although much less than they did a decade ago. Countries like France have excellent health outcomes, very low, very affordable health care, and Scandinavian countries as well do extremely well. I mean, there's no shortage of models for us to look to, I think. I mean, the only model we can pick that won't work is one that we've invented, practically. So I cringe every time a new innovative state reform is developed.
Well, it's one thing we can say is that it's highly fragmented, and it's there's no if you go from state to state or even from payer to payer. There's no rhyme or reason to restrictions for care or even co-payments and deductibles. So I think one thing you have to standardize is what kind of care will be paid for and for how much. Do you agree?
Absolutely. I mean, it has to be a fair standard. There's two problems with having a fragmented system, and by fragmented I mean, hundreds of health insurance programs, of health insurers, and then within each one, hundreds of different plans. It drives up the costs for hospitals and doctors because they have to deal with, 100 different health insurers,
and
each
billing.
with their own rules.
Yeah, billing is such a huge industry, that in and of itself.
Billing, and then for each doctor, the paperwork imposed on each doctor's time just takes them away from their patients. And from each nurse and from each other support staff. So that's one problem. The other problem is that whenever we have this highly fragmented system like this, it's almost guaranteed to be highly discriminatory. Different folks, depending on their geography, depending on their income, depending on their race, their ethnicity, their gender, will end up in these different plans with better or worse coverage, or they'll have no coverage whatsoever. So we need to reduce that discrimination in the system and reduce all the waste that our money is not actually going to the care of people and patients.
So if you're 80 years old, you're not going to get a heart transplant or a sex change operation, and that's got to be pretty much universal for all members of the plan.
I mean, every healthcare system has to make difficult rationing decisions. Countries with a national health plan make it intentionally. They say this is what we have to ration for who. Our system rations based on ability to pay.
Correct.
So we're rationing as well, but we're just rationing in the most unfair possible way.
I think that's what my co-host Jay Johnson was getting at here. That in our last show we talked about the widening gulf between the rich and everybody else in this country. That the average CEO now makes 400 times what the average worker makes. So for every dollar the average worker makes, working at the post office or working, wherever, the average CEO is making $400. So based upon those dynamics, those earning dynamics, the market for healthcare is similarly rationed. The rich have got the money to pay for liver transplants or heart transplants at 80 or 90 years old, and the rest of us don't.
Well, no, it's not that they have the money. They have the insurance to pay for it, so everybody else actually pays for it. You don't just go in and it's not an a la carte system where, plastic surgery may be, but if you're getting a heart transplant when you're 80, if you have a good insurance plan, that insurance plan is paid for by everybody else, and you still get your coverage and what you need because you have that insurance plan, not because you're paying cash for that transfusion or that heart transplant.
Mm-hmm.
The way that our healthcare system is set up, all of the inequalities of the labor market and the economy in general are transferred into inequalities in access to healthcare. If Hispanic residents do worse in the labor market, they're only getting part-time jobs or they're getting jobs without benefits, that means the Hispanic population is going to have less access to healthcare.
Or if they work at Walmart, for instance?
Exactly. And, in most countries, access to healthcare is separated from all those inequalities in the economy and in the labor market.
Mr. Day, 2 weeks ago we had Reverend Graylin Hagler on the show, who's the national, I think he's based out of Boston, with the National Association, the Neighborhood Association Neighborhood Assistance Corporation of America. And he's on their board, I believe, and his day job is he's the national president of the Ministers for Racial, Social, and Economic Justice. Ministers for Racial, Social, and Economic Justice. I can't think of a better example of racial, social, and economic injustice than the healthcare industry. Would you agree with that?
That was Martin Luther King said, of all the forms of racial inequality, healthcare inequality is the most egregious and unjust.
All right, I have some limited access to the Obama campaign. Excuse me, I'm going to cough. I need a doctor. I have some limited access to the Obama campaign. I develop white papers for them on areas of reform on Wall Street. If you were me wanting to get some some proposals for healthcare reform to candidate Obama, where do you start?
Well, I mean, I think the Obama campaign is on the right track. They know that they have to challenge the health insurance industry. So what they're proposing is that there should be a public Medicare-like plan that that businesses and individuals can buy into, instead of buying into the private plan. And that would be helpful because